They send no aorta to the aorta arch.
It depends. Okay, so this guy's pretty well dissected. So when we look at the heart, this is going to be the aorta coming out of it. So this first sort of U-turn is going to be the aortic arch, and then the aorta will continue on in the thorax as the thoracic aorta.
Hold on. Start again.
Okay, so if we're looking at the heart, we have the aortic arch coming out of the heart. It's going to do this 180-degree sort of U-turn, and then it's going to continue along the thorax as the thoracic aorta. Right at this little bend right here, which roughly, if we put the diaphragm back in its normal spot, where it crosses the diaphragm, it'll stop being the thoracic aorta and then continue on as the abdominal aorta. So we have the aortic arch into the thoracic aorta into the abdominal aorta. From the thoracic aorta, there was a couple different branches they had you look for. The first branch coming off is going to be the brachiocephalic trunk, and then the second branch coming off is going to be the left subclavian artery. The left subclavian artery is going to go out to the left forelimb. What happens with this brachiocephalic trunk is it'll actually give off two arteries first. It'll give off the left common carotid artery, which is this guy, and then the right common carotid artery, which is this guy. And then the vessel will continue on as the right subclavian artery.
As the what now?
The right subclavian?
Okay.
So we talked about the left subclavian artery over here. We have the left and right common carotid arteries coming off this brachiocephalic trunk. And then as soon as the right common carotid artery comes off of the brachiocephalic trunk, the vessel will just continue on as the right subclavian. So the carotid arteries are going to go up and do the head and the brain. The left subclavian will do the left forelimb, and then this right subclavian will go out and do the right forelimb. With the thoracic aorta, it'll give off these little branches, which are just the intercostal branches off of the aorta. So each intercostal branch will course down along each rib. So these are all intercostals, and that's really it. There's not a lot of branching off of the thoracic aorta. As soon as we cross the diaphragm and get into the abdominal aorta, then we start to see a lot more branching. Three of the branches are going to be unpaired, meaning that there's just one vessel for each. And you can see two right next to each other.
Those are called the abdominal.
Well, this whole structure is the abdominal aorta.
Okay.
The first branch off the abdominal aorta is going to be the celiac artery. And then right next door to it is going to be the superior or the cranial mesenteric artery. And then the thing that's nice about the arteries is they match sort of the pattern of the GI tract in the organs. So the first branch off of the abdominal aorta is going to be the celiac artery. And it's going to split into three branches that you don't need to dissect out, but it'll branch into a left gastric, a hepatic, and a splenic artery. And they do exactly what they say. The celiac is going to feed the stomach, the liver, and the spleen, which are sort of the most superior organs in the GI tract. So that's going to be the celiac artery. And again, there's only one celiac artery. It's just one vessel. The next branch is going to be the superior mesenteric. And so whereas the celiac artery did the stomach, the next sort of portion of the GI tract is going to be the small intestine. So we're talking the duodenum, the jejunum, and the ileum. And you can see if we look at the superior mesenteric artery and I pull on the mass of the small intestine, you can see how it follows it wherever I go. So that's going to be the superior mesenteric, which is doing primarily the small intestine. You can see they're very small, but there's two paired vessels just next door to the superior mesenteric. You can see there's one right there and one right there, and that's going to be the adrenolumbar arteries. This is the remnants of the adrenal gland right here, but they just course right to those. So these small paired vessels, left and right adrenolumbar arteries, are next. If we move a little farther down, you can see two more paired vessels. And those are going to be the renal vessels. So we have a left and right renal artery, and the renal is just referring to the kidneys. So we have those two renal arteries right there. If we follow a little farther down, this one is going to be more subtle, but there's an artery right here, and the other one may be lost. That may be the remnant of it right there. But that's going to be the gonadal arteries, or the I think they use gonadal. Basically, in a male, it'll be either the testicular arteries, or in the females, it'll be the ovarian arteries. In this cat, it's a male, so this would be one of the testicular arteries. But again, there's two testicles, two ovaries. They should be paired structures. Moving down the line, we can see another vessel that, again, is unpaired. It's just one vessel that comes off. That's going to be the inferior mesenteric artery. So we said the superior mesenteric does the small intestine. You can see the inferior mesenteric is going directly to the large intestine. So it's going to do the large intestine. If we work our way down, we can see two more paired vessels that are going left and right, and these are going to be the iliolumbar arteries right there. I think that's the term. Okay. Sometimes you'll see them referred to as the deep circumflex iliac, but the book's using the iliolumbar. So these are left and right iliolumbar arteries. And then what happens is you can see our abdominal aorta is going to terminate by first splitting into a Y, and we can see the Y right there. The big part of the Y is going to be the external iliac arteries. And you can see the external iliac arteries are going to go down and ultimately supply the left and right limbs. If you dissect out a little deeper, what you're actually going to see, this one isn't great, but there's, after the first big Y, there's a second smaller Y sort of in the fork of our big Y. So we have the external iliacs. The second smaller Y is going to be the internal iliac arteries, and there's one right here. Again, they're going to be paired. There's a left and right internal iliac artery, and they're going to do portions of the bladder and the last little portions of the rectum and a lot of the organs that are found in the pelvic cavity. And then finally, if you look right on the midline, there's one vessel called the caudal artery, which is right here. So we have the first Y, which is going to be the external iliacs, a smaller Y, which is going to be the internal iliacs, and then finally one lone little vessel is going to come out as the caudal artery. And the caudal artery is just going to go do the tail. And people, obviously, we don't have the tail, so it just sort of terminates on our coccyx, which is our tailbone. And those are sort of the main branches coming out.
The end.
So we're doing only the arteries, not the veins.
We need to know the veins as well. The good thing is, if you know the arteries, for the most part, you'll know the names. So for a lot of the arteries we've seen, there's just paired veins. The one thing I wanted to show you, too, is we spent time talking about that portal vein, right? So if we follow, we can see in the small intestine here, we can see these nice injected arteries, and we can see these darker veins right here. And if we follow these veins, you can see we get to the structure right here, which looks just like a large sort of uninjected vein. And you can see right here, this is the inferior vena cava right here. You can see it has blue latex. But we have this set of veins right here, which are uninjected. That's going to be that portal vein. So all the veins coming out of the small intestine from the large intestine, they're draining into this portal vein right here. The portal vein, it's hard to follow, and you don't necessarily need to follow it, but it's going to course up, and ultimately it's going to end up in the liver. And then from the liver, all the blood's going to drain out through the through the inferior vena cava, which is right here, and you can see that it has blue latex in it again.
Wait, where's the inferior vena cava?
This is inferior vena cava right here.
The other part is at the bottom.
This is the portal vein. If we're in the GI tract, this is going to be that portal vein that we were talking about.
Oh, this one.
Oh, that's going to be the inferior vena cava?
You said that.
So the
that
other one is the
inferior.
superior one.
Yeah, so if we go to the heart, this guy doesn't have the best injected veins, but this is going to be the aorta, which is the main blood flow coming out. The main blood flow going in is going to be the inferior vena cava right there, and the superior vena cava, which is right there.
Oh, okay.
So we have two big veins converging on the heart, superior vena cava, and then the inferior vena cava. One artery coming out, which is going to be the aorta. But this is just the continuation. It's sort of cut right here, but of the inferior vena cava. So with aorta, the inferior vena cava is going to be coursing with it through the abdominal body and really through a lot of the thorax. But yeah, I definitely wanted to point out this portal vein right here. So you can see all these veins coming out of the small intestine. Instead of just dumping into the inferior vena cava, going back into circulation, they all coalesce into this larger vein right here. That larger vein will go into the liver, break up into a second capillary bed, and then you can see all this blue latex sort of mixed in. Those are all hepatic veins, which are going to dump directly into that inferior vena cava.
And then what other veins?
This isn't a good one for doing it. I don't know if there's other cats out. But this is when most of them are gone on this
I
cat.
have
We can take a look at it.
So the
the femoral.
Yeah, this one isn't. Oh, well, actually, I take it back. Some of it is. So if we follow it out, this isn't a great example, but we can see the first couple branches. So if you follow the book mentions this middle hemorrhoidal artery. It's a branch off the internal iliac artery. Don't worry about it. You have to really dig to get it out. So you can cross out the middle hemorrhoidal artery on the bottom of page 33. It's one of the branches off the internal iliac, but you have to split the pelvis and really dissect. Yeah, just cross it out. It's not clinically that important. The one thing I wanted to show you, because this one has a decent one, if we follow the external iliac artery, what happens is it starts in the body cavity. So if we sort of put back the body wall, it's going to start its life as the external iliac artery.
I'm gonna do the same thing.
But what'll happen is it'll pass through the body wall, almost like we saw with the inguinal canal. It's a little bit different, but it'll pass through, and as it passes from inside the body to outside the body onto the leg, it'll just become the femoral artery. So at this point, basically from here to about here, it's going to be the external iliac artery, and from here outward, it's going to start as the femoral artery. But one of the branches they have you look for is right at that junction. There's this branch that comes out and it courses inferiorly, and that's going to be the deep femoral artery. So that's this guy right there. The saphenous it's not completely dissected out. We really need to dig more. What happens is, right about this point, the femoral artery is going to dive into these muscles, but it has a really thin continuation. But a lot of times it's lost when they skin these guys. So what we should see is a small artery coursing right here, and that'll be the saphenous. This isn't a great example of it. Yeah, this one's okay. Again, it's not perfect, but you can sort of see it right there. This is going to be the saphenous artery. It's one of the few examples of arteries that stay very superficial. Most arteries, like the continuation of the femoral, like to be protected between large muscle groups because they're so dangerous it's so dangerous if you damage them.
Okay, so for the other cat, we'll do the veins.
If it has decent veins, yeah.